Nysa Therapy Incorporated presents Healing Personality Disorders. Introduction.
It is ethically and clinically appropriate to seek supervision or consultation before using any new technique in your practice of psychotherapy. Please contact us at nysatherapy.com if you would like to receive guidance from our highly experienced consultants.
Here is Dr. Stephen Diggs, Nysa Therapy founder and director.
Hello, everybody. I'm Steve Diggs, and I want to welcome you to Nysa Therapy's course on healing personality disorder. We are really excited you're here. That's for real. We love what we do. We love the process of treating personality disorder, engaging it day after day, moment by moment, learning about it, and watching patients get better, watching patients feel free and alive in ways they haven't before. It's thrilling. So you're here, which means you've got a real interest in this, like us, in how we can go about helping a population that so desperately needs it. So we're very glad you're here. Let me talk a little bit about what we do at Nysa. First, we treat 12 different personality disorders, and all of the personality disorders that are in the DSM we treat, and then we add a couple in from past versions of the DSM that have been left out. And we'll get to a thorough list eventually. Don't want to intimidate you yet with a bunch of names jumping out, but there are 12 different ones, and we have ways of treating each of them. Some of them much more successfully than others, but all of them we've had some success with. And so that's the first thing we do. We operate a clinic in Chico, California, and we have patients that come in referred from family members, the telephone book. We receive many referrals from the psych unit here, the inpatient psych hospital in Chico, and then people who just hear that we treat personality disorder and they've done their own research. They've gone online and they think that they have these conditions, and of course they usually do, and they come in looking for us. We train therapists in the Nysa Therapy method. We're doing that right now with you. We're going to give you some education, give you some training on how to do that. And we do it intently in our clinic, where we hire associates, but also licensed therapists who want to come in and spend some real time working every day with us, getting a lot of training every day, and learn the methods that we've developed. Everybody here gets a full 6 hours a week of supervision and training. We are really committed to that, and we think this is such a hard job to do. They need this time to learn this. And also it is in these training activities that we develop new ideas, that breakthroughs happen. So we spend a lot of time doing that. And then finally, we produce educational materials like the one you're watching now. So, the first thing I want you to do is to meet a few of our therapists, and they're going to start by telling you some of the things they have been told as they were coming up through graduate school or attending internships or externships, associate training, or just license training. They're going to tell you some of the things they have heard about personality disorder.
The education that I got was very little, very minimal in the social work department. And we just learned about the DSM and some of the criteria, but it wasn't really talked about that much in the educational setting. I do remember when I did have my first job, and I had this client who it felt like a lot. And I went to my supervisor and I was describing what had happened and what the things that we talked about. And I said, I don't know what's going on. I just feel my emotions all over the place. I kind of feel like I'm in a hurricane or a whirlwind. And she just said, well, thank the universe, they just gave you your first borderline. And I was just like, okay, but there was nothing practical that I could take away from that, and that, that was going to be helpful to work with this person that was in really dire need. And so I kind of just fumbled my way, and definitely brought up that client a lot to my supervisor, but there was no concrete information that I got.
In grad school, they didn't teach us much in depth about personality disorders at all. I think there was like a brief overview of the basic personality disorders, and it was followed by like, you don't want to work with this population, was essentially the message that we got, and that it wasn't even really worth time teaching us about. And then I also had several experiences with supervisors who has said the same thing, like, if you want to work with people with personality disorders, like, you shouldn't work in my office because I don't work with that population. They basically told us that if we went into working with that population, that we were going to hate being a therapist and inevitably fail at it.
I think the impression that one would get from the way PD is talked about in graduate school was that it's not curable. That there was something about personality that's immutable, and that you couldn't really move it very well, change it very well. And so, yeah, that you couldn't do much about it. There were some therapies such as DBT that could help manage it, but nothing that could cure it. That's the impression that I got. And I remember one of the things that people said is, well, you would never want more than one person on your caseload that has personality disorder because they're so hard to deal with, especially borderline. Like, you never want more than one person with borderline on your caseload. And I think here we feel like we're really lucky if we have a high percentage of people who are borderline on our caseload, because that's where we really see a lot of change take place. And never had a group of patients so eager to get well. And it becomes a really wonderful collaboration between you and the patient.
As you can tell from what our therapist just told you, many people believe that personality disorders are scary and weird. Or mysterious and impossible. The truth is, people who have personality disorder are not weird or mysterious or strange. And their conditions are not weird or mysterious or strange. They are ordinary people who were hurt in childhood. That's all. Many people believe that personality disorders cannot be healed. They are wrong. Let's just say it. They're wrong. And how do we know that? We know that personality disorders can be healed because that's what we do every day here at Nysa Therapy. And now you get to listen to some encouraging news from our therapists.
Since coming to Nysa, I have learned so much about personality disorders that has made it much less scary for me, kind of seeing it as just like a trauma-based thing, not seeing these people as monsters, just people that are hurt. I've learned that it is treatable. I've seen it be treated. And I love working with this population despite what I was told about them. In school, they definitely encouraged us to keep a very professional boundary in sharing our feelings. I was fortunate enough to have a couple of supervisors that did kind of encourage me to go from being in my head to thinking from my heart or acting from my heart, and connect with my patients in that way. And Nysa was definitely like a step further in me being able to kind of let my walls down and be able to do that. And it just feels, for me, so much more natural. It definitely, I think that when I talk to people about it, there's ethical concerns about that, but I feel very connected to my patients, and I feel like there are professional boundaries there. And like I have a real relationship with them, which is very healing, I think, for both of us.
My attitude toward PD is completely changed since coming to Nysa. Although I would say I was probably, I knew something was up. I felt something was up. I wouldn't have come to Nysa if I didn't think what I had been taught about PD wasn't exactly right. And that the patients that, I was encouraged to diagnose with depression and anxiety and things like that, that there wasn't a missing piece there. And so one of the things that I learned since coming to Nysa is that PD is a lot more common than people want to admit, because if you don't think something's curable, why are you going to diagnose it? And what I have found since then is there seems to be an element of PD in almost every case. And if you're not approaching it that way, you're putting a Band-Aid on something. One of the things that I have said is it seemed like in the work I was doing before coming to Nysa, my job was to help make somebody functional. It didn't really matter if they were miserable as long as they could, hold down a job. And that's one of the things that really motivated me to change and find something new, because I wanted to believe people could be cured. And then since being at Nysa, I've seen people being cured. And it's really a huge change in my head over what PD is, how common it is, and what can be done about it. I think I'm one of those people who kind of found their way to Nysa because they found themselves doing things in their practice that were not being encouraged by others, but felt really natural to them. And I do a lot of self-disclosure when I'm in therapy with people, and what Nysa's really taught me is how to use that as a tool, how to target it, what feelings are of particular power when they're shared. Boy, it's just, what's interesting is I've had patients that I've worked with before Nysa and before understanding the Nysa methods. And quite frankly, there's a little bit of a transitional period when I'm doing something a little bit different with them. But people who weren't changing before, and just by changing methods, have my relationship with the patient has changed, and they're getting better at a much faster rate than they were before. So.
Coming to Nysa has just been a breath of fresh air, because now I don't feel so alone in trying to help this population, the people that I've come to care about a lot, my patients. It's not as scary as what you hear in school, and I have seen people get well, and I have seen people feel better and, live the lives that they want to live. And I don't think I ever would have had this opportunity if I had not learned the methods that Nysa teaches.
We know personality disorders can be healed because we can do it. Do we do it as much as we would like? No. As often as we would like? No. as deeply as we would like? No. But we regularly have patients with full personality disorders who have full recovery. Now, this is the early stages for us, and we want to get a lot better at it, but we know it can be done because we can do it. But there are well-known methods that have been doing it for years. Now, this kind of cracks me up, that people are walking around saying personality disorders can't be healed, and there are models out there that have been in existence for 20, 30 years that have been healing personality disorder. And they're famous models. People know about them. So why is this thing going on? I don't know, but I believe it's just the intimidation that personality disorders pose. But still, a lot of people have been doing it long before Nysa Therapy came along. So let's talk about how that's been done. There are two types of methods. School methods, and these are methods that developed within a traditional school of therapy, or integrative methods, methods that combine different kinds of methods of psychotherapy into a single integrated state. Here are the traditional schools of therapy that you probably learned in the first year of your graduate program. Psychoanalysis, cognitive behavioral, humanistic, systemic, strategic, and experiential. There they are, and within that, there have been some very successful methods for treating personality disorder. For example, transference-focused therapy, which comes out of psychoanalysis, that's Otto Kernberg. Interpersonal therapy, which comes from the tradition of Harry Stack Sullivan. Lorna Benjamin is the primary advocate of that method. The Masterson method. Guess who invented that? James Masterson, which he was a psychoanalyst who invented a method for treatment of PDs. CBT, cognitive behavioral therapy. Judith Beck has a method for treating personality disorders. And then mentalization therapy, which is Peter Fonagy, and he comes out of the psychoanalytic tradition. So, these 5 schools have been treating personality disorder, all of them for 20 plus years. We know it can be done because they've been doing it. So, there are 2 integrative therapies that we know of that successfully heal personality disorder. The therapists who invented them inspire us the most because we are very integrative in our approach to these things. And these 2 people who have successfully done integrative therapy that specifically treats personality disorder, they inspire us. They're our heroes. We're standing on their shoulders. Jeffrey Young, who developed schema therapy, and Marshall Linehan, who developed DBT. Now, schema therapy is integrative, and it integrates CBT, object relations theory, psychodrama, and education. I love that. That's a really gutsy set of integrations because they all seem so disconnected from each other, like they wouldn't have anything in common, but they do. DBT is integrative. It integrates CBT, radical acceptance therapy, mindfulness, and education. So, why is integrative better? We've got these old methods, the school methods that developed in their schools, transference, focus therapy, interpersonal therapy. Why do we need integrative? Well, no therapy is good at everything. Each therapy is good, really, if you look at it, at about 1 or 2 things and not very good at the rest. I'm talking about really good. Each therapy does a couple of things that are just amazing, and then everything else, okay, but not that great. So, no therapy is good at everything. When you integrate, you take the things that each therapy does well, and you combine them with the strengths of other therapies. So if each therapy does one or two things well, you do this well, and you do this well, let's put them together, and now we've got the two best things that these two therapies did together instead of each of those sitting alone. Makes total sense to me. Put them together. It's like an all-star team, right? It's putting an all-star team together, or a super band where you put these super musicians together, right? You get the best and put them together. When you integrate, you end up with a therapy made up of the things that work well without the things that don't work well. So not only are we putting these two good things together, but we're leaving behind the weaknesses of each therapy. So if you do this one thing well, and you do this one thing well, maybe this thing does what these other lesser things over there used to do. But now you've got a really good way to do that, right? A really good way. It's kind of like preparing a meal made up of many ingredients instead of just one. Tomatoes are good, but look at that stew. That's got to be better. Looks very good. I'm kind of hungry right now. So, I'm making the case to you of why integrative is better. I'm making that case. But now, I want to make the case why NYSA is necessary. If we have schema therapy and we have DBT, why is NYSA at all necessary? First, we integrate many therapies, not just 2 or 3 or 4. We have upwards of about 20 plus therapies that we integrate. It was bound to happen if you think about it. Therapy has only been around, let's say 1900, when Sigmund Freud got things started, 120 years. Modern therapy has been around. It's really brand new. If you compare it to the history of architecture, which goes back, 7,000 years, the history of medicine, which goes back, 4,000 years. If we look at these traditions within our culture, we see that modern psychotherapy is really a baby. And so it's kind of wrong to think that any one therapy is any good right now. I don't think Nysa Therapy is that good. I think Nysa Therapy will and should be replaced by something better 20 years from now. Just like integrative therapies replaced school therapies, our therapy is a step in the right direction, but it should be replaced. So if you look at the way things are going, once integration started and we see, Linehan and Young doing their integrations of 2, 3, 4 therapies, it just makes sense that somebody was going to come along and integrate 20. I mean, this thing is going to keep marching forward. This enterprise is going to keep going forward. So we're kind of assuming and hoping that there are other people out there that are integrating a lot of therapies, 20 plus. We haven't met them yet, but we think they're out there. We'd love to meet them and talk about things, but someone was bound to do this, just like someone's bound to take the place of what we're doing. NYSA is also necessary because we're integrating therapies that have not been put together before. Specifically, we're integrating strategic therapy and solution-focused therapy into psychoanalytic therapy, psychodrama, CBT, the ones that we've seen Jeffrey and Marcia put together. We're integrating solution-focused, and it's making a lot of difference. But we're integrating other things as well. So, get ready. Here's a list of the therapies that we integrate. I'm not even going to read them. I'm just going to let you look at them. because they do go on and on and on. But from each of these therapies, we have obtained something essential that no other therapy does better to put together in this weaving together of these different strands of therapy. Each one of them does something absolutely unique or better than the other therapies. So, let me tell you a story about the 7 blind gurus and the elephant. It comes from India. This little girl is walking along one day, along a path she walks down most of the time, and here she hears 7 gurus arguing. And she hears them kind of fighting intently, and she wonders, well, what are you guys arguing about? And they say, we're arguing about the nature of an elephant. And she says, well, haven't you seen them? They say, well, no, we've never seen an elephant. I mean, we're all blind. And she says, well, you can touch and feel, right? They say, yeah, well, why don't you go find an elephant and feel it and find out what it's like from that? And they go, brilliant idea. So they head off to find an elephant. The next day she walks back and they're still fighting. And she asked them, didn't you find an elephant? And they said, oh yeah, we found an elephant, but we were just still confused by the time we were done. She said, well, what happened there? They said, well, we don't know, but maybe you can help us. And the first one says, I felt that an elephant is a lot like a spear. And the second guru says, well, that's funny because I felt the elephant and I thought an elephant was a lot like a snake. Number 3 says, I thought an elephant was like a great big fan. And the next one says, I thought an elephant was like a big brick wall. Next one, I thought an elephant was like a tree, a big hefty tree trunk. Next one, I thought an elephant was like the shell of a turtle. And the next one says, I thought an elephant was like a rope. And she says, well, you're all right. And they say, no, that can't be. How can that be? And she says, well, the tusks are what feel like a spear. Those are the elephant's teeth. The trunk is the elephant's nose, and that feels like a snake. The big fans that you think are fans are the huge elephant ears. The body of the elephant is what feels like a wall. The leg of the elephants, which are big and huge, feel like a tree trunk to you. The feet feel like a turtle shell. And the tail feels like a rope. When you put them all together, that's what an elephant is. And to this, the gurus exclaimed, an elephant is a strange animal indeed. Nysa Therapy is a strange animal indeed. We have put together so many different points of view and techniques and attitudes and approaches to therapy that it looks a little strange when you first look at it. But if you hang with us, take the journey, we'll explain to you why each of these parts is essential and why each of these parts make a therapy that actually does work quite well.